There is need for improvements in the application of digital technology in the delivery of healthcare in the Eastern Caribbean in a bid to enhance the quality of care to its citizens. That was one of the focal points of the discussion organized by the Eastern Caribbean Central Bank on what lessons we as a region would have learned from the pandemic and its impact on healthcare. Dr. Caroline Radix, head of the Human and Social Division of the OECS Commission, was one of the panelists. She said the COVID-19 pandemic has taught us to apply digital innovations to healthcare.
This COVID pandemic has taught us we've done things digitally within a very short period of time that we've been planning to do for a long period of time. And the health system is no different in terms of how we've been handling care within the COVID pandemic. And we need to use what we're learning to be able to expand and reduce the cost with regards to the and increase the quality with regards to treating diseases at that level, which we must have and we must always have. And so we need to be able to do it differently, working together to pool resources and tapping on resources that are not physically in our space.
Meanwhile, Mr. Damien Grays, professor in the Department of Humanities and Social Sciences, said in the region there's a scattershot approach to budgeting for health care.
When we look at the health budget, we have to begin to be more targeted. As far as I see it now, and using my experience from before as a Minister for Health, we have a scattershot approach to the budget for health rather than a rifle shot approach. So we put in a lot of things. We say we're doing this, we're doing that, we're doing that, we're doing that, we're doing that. We do not look at the overall picture as far as I'm concerned. Maybe we are doing that a lot more these days, but we are not there yet. A more targeted approach within the confines of our framework, within the confines of the information we have before us. I mean, household surveys are sadly absent. So a lot of those things not on the periphery of that are important as part of the composition of your health planning and policy is absent. And then I'm saying, if you're looking at more affordable and equitable health, you have to see it as being inextricably linked to the elements of what I call universal access to healthcare. So there has to be the increased and more effective community service. The health checks and awareness, all of that is part of the gambit. Health checks and awareness in schools, in communities, increased community facilities to stimulate exercise and other recreational activities like sport and so on. And all of those things will come in, your special concessions for certain targeted areas. These are the things that we have to look at. So we have to be a lot more innovative, more rifle shot in terms of our approach and strategy rather than the scatter shot. And basically, we're against the backdrop of the framework for public health and the essential public health functions, we should be able to have a better approach.
The ECCB session was entitled Digital Dialogues, which is a regular virtual meeting of the minds in the Eastern Caribbean discussing a wide range of issues of regional significance. Andre Huey, SKN Newsline.